I don't know if there was a pivotal moment, but I think there were a series of um, events in my life that led me to decide um, to choose to to choose to do breast cancer. I think one was when I was a college student. I was in it was a summer between my junior and senior year, and I needed a job. But I wanted to do something interesting, but given my circumstances, I also needed to get paid. So I fortuitously got a job through the city had a program where they were paying college students, but it was like an internship. And I ended up working at Harlem Hospital with this fantastic researcher who was doing who had a program where she was screening elderly women for breast and cervical cancer. And I spent the summer working with her, and it was my first exposure really to public health. I didn't realize that's what it was. That wasn't, she didn't could name it that, but that's really what it was. So it was a breast and cervical cancer screening program at Harlem Hospital, and it was specifically targeted to women over the age of 65. And it was an eye opening experience for me because I was seeing women in their 70s and 80s who had never had a pap smear before and who had never had a mammogram before. Not all of them, but I would say the majority of them had never had one before. And so it was an eye opening experience for me. And it was heartbreaking. And also, it was also heartbreaking for me because even as a college student, I was, I was able to figure out these are women that were part of the medical system already because there were already hospital patients that were being funneled into this screening program. So I just couldn't understand why they had not been offered these tests. So it was interesting. So I asked the researcher if I could interview them. And that formed the basis of my senior thesis, which won a prize at my graduation. That was, and even then, I still hadn't quite made the connection that I was going to go into breast surgery or surgery, but it kind of laid the foundation for me to go into public health also. And then when I did my residency, I was trying to decide, well, which way should I go as far as specialization. um, I I knew I wanted to work with cancer. I just wasn't sure which one, and it just everything comes full circle. And I just realized I enjoyed working with women, and I saw that you know I learned so much from the my mentors who were doing breast. They thought they were great surgeons, and I thought I can do this too. And I was really surprised that even though this was a field that was working with predominantly women, there were so few female breast surgeons. That's changing now. That's changed, but when I first started, there were still so few female breast surgeons. And I said, that's very interesting. So I thought I thought that, and I saw that there were many women that were having so many negative experiences um, with their cancer care um, in the way they were treated by their physicians. And I thought that, maybe if I decided to go into this field, maybe that might help, you know. But I also felt that I also needed to get involved so that we can make some differences on a broader level to deal with some of the health disparities. So that's when I sort of decided that this would be a nice way to combine a lot of my interests.